are linking these chemicals, but it doesn't happen always right away. And so this is the problem. They can push it off and say there's not a threat. But Darryl, at this point, you're coughing up blood. Is that correct?
No, no. After I was taken away from the chemicals, within a month, I stopped coughing up blood. The welts went away. My ear infection went away. What I have now is a sinus infection, and what my pulmonologist is determining is that the chemicals burnt the inside lining of my lungs, and scar tissue does not expand and shrink as well as elastic normal tissue. So I still go to the gym, and believe it or not, private investigators follow me to the gym, you know, and try to say that I was not damaged or whatever. But the facts are the facts. CT scans are CT scans, and breathalyzer tests from pulmonary docs show that my lungs do not work properly, and the CT shows that all 6 of my sinus cavities are infected. And yet, but once again, Liberty Mutual wants this to go away, so they canceled my operation, believe it or not, and then sent me into a second opinion. But it gets even better than this. This is how they make people go away. If you see right here, I don't know if you can see, but they call me non-disabling on the initial workers' comp report. When Rob Davis came out with this and it hit the front page of the newspaper, they changed it to a disabling injury. So you talk about huge companies that want this to go away. I was considered, I was getting ready to get washed under the carpet, and Liberty Mutual was going to make me go away. And if it hadn't been for Lisa Arkin at Beyond Toxics, no joke, my urine test would have never left that hospital. It stayed there for 3 days, and they had to escort me out of the Roseburg Hospital with security and risk management because my urine test still hadn't been sent out to get tested for pesticides and herbicides. So the whole system's set up against the person that gets sprayed, or the community, or the pregnant mom, or the person that says they have an ailment. I'm blessed in the fact that I had Lisa there to help me avoid some pitfalls, and that I took my videos, and that I was in good prior health, because I think without all the ducks in a row, personally, I think I would have been swept under the carpet long ago.
Wow.
I just was going to say a few things. Just that, so Applebee's, $3 million annual renewable contract. And Applebee's is one of many contractors who take on contract positions with the Forestry Service to spray these chemicals. And so they are the low man on the totem pole as far as the companies go. That's $3 million contract. Then we have Darryl, guys like you, 20-year-olds, young folks being exposed to these chemicals, and they are cheap. They're cheap, and they get in the way, especially when they talk up. And I just feel like we need as a society some systemic answers. And all of us need to speak up. So we can't just say, okay, we're going to leave it to the doctors or just the EPA or just the guy spraying it. I just want to say we need to be bold. And I want to applaud you, Darryl, for being bold and for taking this issue on and for being the guy in the forefront who's decided to speak out about it. And I want to caution you too. I know this comes at a cost, not just for your health, but I know this is a time where you could be in personal danger. And I know Carol, you and I just want to say thank you for being bold and take it cautiously.
Well, I'm broke. I live in a one-bedroom apartment. I argue with my workers' comp people all the time. And I do not know what the future holds with my health. I do know one thing, that I'm going to be more dedicated to my eating and my exercise practices and to whole body health, just to avoid any future carcinogenic possibilities due to my exposure. But you know what? Thank you for applauding me, but I didn't choose this, and I don't want it. I really don't want it, but I'm stuck in this position just due to the sequence of events.
Yeah, Darryl. Let me ask you a quick question before we go. What did your urine test show? Like, in the end, what were you exposed to?
They say I was exposed to, I don't know how to read this properly, maybe you can see it, but it is 500 ng/ml. No, 5,000, which, according to most folks, if you do that breakdown, is a super, super duper exposure. It's, in other words,
And
you're
what
drinking,
chemical?
basically.
What chemical did it say?
Atrazine.
Atrazine.